So let's discuss about the wind stroke. What is the meaning of wind stroke? The meaning of wind stroke, the person got sudden paralytic attack. एक व्यक्ति को एकदम से पैरालिसिस हो गई. The sudden paralytic attack. And during this condition, person need hospitalization. Or the person sudden fall down on the floor. व्यक्ति एकदम से फ्लोर पर गिर गया. Falling down on the floor. Like I will tell you, one of my patient, one day when he is working at very high post in TCS, the wife came in the home and the person was falling down on the floor since 30 minutes, unconscious. No one was on the home. घर में कोई नहीं था. Immediately took the hospital. Even doctor told you came on the right time, and doctor gave some medications, some anticoagulant injections. कुछ डॉक्टर ने इंजेक्शन लगाए, जो क्लॉट बन गया तो उसको घोलने के, and person got some percentage of the relief, maybe 30 to 40% relief. Then remaining relief be did by the our acupuncture treatment. So this is wind stroke. इसे हम पहले बोलेंगे wind stroke. Wind stroke means person becoming unconscious, person falling down on the floor. व्यक्ति जमीन पर पड़ा हुआ है, व्यक्ति गिर गया. We can see the eyes are deviated. उसकी आंखें टेढ़ी हो गई. And there is a might be saliva coming from the mouth. From mouth. Sometimes we can see the urine is coming from the mouth. Even sometimes we can see urine, stool are coming out from the mouth. Sorry, urine is coming out from the urinary path and the stool is coming out from the anus. So urine is coming from urethra and stool is coming from anus during the paralytic attack. And the eyes are deviated, even the face is deviated. So when this thing is happening, we are telling it wind stroke. हम इसे wind stroke कहते हैं. In the acupuncture, we are dividing in two parts. There are two types of wind stroke. Number one, we are telling external wind stroke, and number we are telling internal wind stroke. WS means wind stroke. So the external wind stroke, because of the external reasons, external evils, external pathogens. Like what is the external evils? We know the external evils are like the cold, like the wind, like the heat or hotness, like the humidity. These all are external evils, right? Suppose someone is walking or coming in the exposure of cold water or the cold air. Or swimming in different, any type of the cold, and the body is becoming cold, body is getting attack of cold, or the person is coming in the contact of wind. It might be wind, it might be wind heat, it might be wind cold. व्यक्ति को ठंडी हवा, गर्म हवा के संपर्क में आ गया, or the person is coming under the exposure of heat or the humidity, dampness, excessive dampness. So any external evils or the pathogen will work like a external factors, and they are responsible for the external wind stroke. On the other side, what is the internal wind stroke? There is no any attack of external evils. कोई भी external evils का attack नहीं हुआ, अंदर ही अंदर हो गया, उसे कहते हैं internal wind stroke. Right? Internal wind stroke is more critical. This is the more critical and more serious. So if you want to understand little more about the external evil, I will give you quick example. Like person was taking cold water bath, व्यक्ति ठंडे पानी से नहा रहा है. The person is doing journey in the train, window open, or driving the bike and coming in the exposure of lots of wind. It might be wind, it might be wind cold. That is external evil. ये external evil है. Person is coming in the exposure of excessive heat. The heat, there too much heat, because of the heat also, after some time there will be a rising of blood pressure, rising of wind, and something will happen. Means right now, just I am telling, they are the external evil. ये सब external evil हैं. Or the person is coming in the exposure of dampness, too much dampness, and dampness will create blockages. Dampness or humidity का nature है blockage पैदा करना, and suddenly, so these all are external factors, external evil. So they are responsible for wind stroke. Now on the other side, person has not done anything. उसे कुछ नहीं किया उसने. ना तो ठंडी हवा के संपर्क में, ना गर्म हवा के संपर्क में, ना ठंडे पानी के, ना गर्म पानी के, ना गर्मी के संपर्क में, ना डैम्पनेस के संपर्क में. पर्सन इज अवे फ्रॉम ऑल दीज थिंग्स, still getting paralytic attack, still getting wind stroke. That is internal reason. They call internal reason, internal wind stroke. That is more dangerous. वो ज्यादा खतरनाक है. खतरनाक दोनों ही है, लेकिन अंदर वाला और भी खतरनाक है. पर सडनली पर्सन इज, आपको वैसा ही है. सरला जी क्या बोल रही है? सरला जी को वैसे ही मतलब हो चुका है क्या? मुझे वैसा ही है. अब internal, why the internal wind stroke is very dangerous? Suddenly person is getting unconscious, suddenly falling down. He was doing some work, कुछ काम कर रहा था, और suddenly fall down, become unconscious, or went in coma. कुछ नहीं था, कुछ भी काम किया. He was doing some work. Maybe he was taking some conference. He was talking to someone. He was in the meeting. He was talking to someone. कोई व्यक्ति किसी से बात कर रहा था, कोई गाड़ी चला रहा था. One cardiac doctor was driving the car, and as soon as he driven the car, after few kilometers, suddenly he got paralytic, wind stroke. That is internal cause. So internal cause means they are more dangerous. Person will suddenly fall and might go in the coma, might become unconscious. So that is the second type. So there are two types of wind stroke. One is external wind stroke. Second is internal wind stroke. So what are the causes of internal wind stroke? Because if we talk about the human body, अगर हम human body की बात करें, as per the acupuncture, there are two main things in the human body. Number one, organs, and number two, meridians. If we talk about the organs, we know heart, we know lungs, we know kidney, we know large intestine, we know small intestine, we know many organs, ovary, testes, the lots of organs in the human body. So internal means maybe some organ is having some problem, maybe heart is weak, maybe lungs are weak, maybe kidney weak, maybe large intestine having some problem, maybe small intestine having some problem, maybe spleen is having some problem. Means internal might be because of some reason we don't know. Right now just we are trying to understand कि internal होगा तो किससे होगा. भाई अंदर तो क्या है, अंदर तो organ है ना, organ ही है. या तो ऑर्गन में गड़बड़ी या मेरिडियन में गड़बड़ी है. There are only two possibilities. So the first cause, if the person is getting wind stroke, there might be problem in the heart, there might be problem in the lungs, there might be problem in the spleen, or the person might be having problem with the meridians. We know that we are having 12 meridians. So maybe some meridian is weak, maybe kidney meridian is weak, maybe spleen meridian is weak, maybe lungs meridian is weak, maybe heart meridian is weak. On the one side, we're talking about the organs. On the other side, we're talking about the meridian, because we know organ are the different thing and meridian are the different thing. दोनों अलग अलग बातें होती हैं. किसी का स्टमक कमजोर है, वो एक अलग बात हो गई कि पेट कमजोर है, पेट गड़बड़ रहती है. और स्टमक मेरिडियन अलग बात होगी. स्टमक मेरिडियन मींस स्टार्टिंग फ्रॉम द below the eyes, then crossing the throat region, then crossing the chest cavity. So meridian are the different thing. Agree? Meridian are different, organ are different. दोनों अलग अलग. So internal wind stroke, the person might be having either the problem in the organ or the problem in the meridian. It is called. So there are two are the most probable cause. ये दो मुख्य कॉज हो सकते हैं. यही कॉज है. So in this way, if we talk about the internal wind stroke, which is more dangerous, person might suddenly fall down and getting wind stroke. Okay, maybe becoming unconscious and go in the coma. एकदम से बेहोश हो गया. इंटरनल विंड स्ट्रोक. तो कारण हमने समझे. एक हमारा हो सकता है कि मेरिडियन में, because meridian are the channels. Suppose this is the human body. The lots of meridian passing all around. Lots of meridian passing all around. So either the meridian or maybe some other channel. Meridian means energy path. Maybe some other path. What is the other path? कौन से दूसरे पाथ होते हैं हमारे शरीर में? एक तो नॉर्मल मेरिडियन होते हैं, और कौन से पाथ होते हैं? लियो बेसल का पाथ होता है. Leo vessel having path, because maybe sometime you will see like the meridian, we have Leo meridian, Leo vessel meridian. They are having different path. I will tell you one example. Suppose heart meridian is starting from here. Heart 1. But EOB. ये सबने EOB क्यों लिखा, समझ में नहीं आया. आपने EOB क्यों लिखा है? इलू लिखते तो समझ में आता. EOB का मतलब क्या है भैया? EOB की क्लास तो सोम बुध गुरु शुक्र होती है ना. EOB class is Monday, Wednesday, Friday. We announced already. And TTS for paralysis. आपको लग रहा है कि ये EOB में पैरालिसिस कहां से आ गया, ऐसा लग रहा है आपको? कविता जी ऐसा लग रहा था क्या? EOB क्या? अच्छा, आपने EOB पाथ बताया है. Oh, sorry, I got confused. Sorry. You're right. So we are having divergent channel. They're the horizontal channel, divergent. We are having Leo vessel channel. आपको एक ही ध्यान था, EOB बस. एक है EOB channel. We are having many channels in the human body. So if internal wind stroke means there is problem in the some channel, yeah, lymphatic channel, muscle channel, there are many channels. Slowly you will learn everything. So now, the first internal wind stroke due to meridian, due to extraordinary meridian, due to divergent meridian. There are many channel, divergent channel, due to Leo channels. Some problem in any channel. कोई ना कोई किसी ना किसी channel में कोई problem है. So it will create internal wind stroke, and the problem in the organ, or problem organ में होगी. So that will create the, so these two conditions will create wind stroke, right? Whatever the reason, अब कारण कुछ भी हो, but we already have discussed there will be two type of paralysis, two types of paralysis. Either it will be spastic or it will be flaccid. दो प्रकार की होगी पैरालिसिस, या तो स्पास्टिक होगी या फ्लैसिड होगी. So what we have understood? We have understood in that way. What is wind stroke? This is the wind stroke when someone is suddenly falling down in the floor, becoming unconscious. That is wind stroke. How many types? External, internal. External because of wind, cold, heat, humidity, some external pathogen, external event. And the internal wind stroke is because of internal reason, like either the organ or the meridian. Means channels. Now we talk about the channels. There might be many channels like meridian, like extraordinary meridian, like divergent channel, like Leo channel, like muscle meridian. कोई भी channel. And second is organ. They will create internal wind stroke. ये क्या पैदा करेंगे? ये internal wind stroke पैदा करेंगे. Got it? So on the other side, there is problem in the organ. There might be organ, yin organ, and there might be yang organ. हम जानते हैं कि हमारे अंदर yin organ होते हैं, yang organ होते हैं. So now, let's talk about the condition. One patient came to you. With the paralysis because of any reason. एक व्यक्ति आपके पास पैरालिसिस के लिए आया किसी भी कारण से. So do you think treatment will be same? So the answer is treatment will be different, little bit different for every condition. हर कंडीशन के लिए ट्रीटमेंट थोड़ा थोड़ा अलग अलग हो सकता है, right? So as per the TCM, what is the treatment procedure? So first is the common procedure. First is common procedure for all. सभी प्रकार के पैरालिसिस के लिए एक कॉमन प्रोसीजर है. So first we'll talk about the one common procedure for all, which is applicable for external wind stroke, for internal wind stroke, for everything, for every type of paralysis. That is a common pattern. Then we further go and we'll talk about what we'll do for if the paralysis due to organs, what we'll do if the paralysis बिकॉज ऑफ द मेरिडियन। हम इनमें क्या करेंगे? अगर मेरिडियन के लिए तो हम क्या करेंगे, और ऑर्गन के लिए तो हम क्या करेंगे? बट विल डू दैट। आई विल टेल यू वन थिंग, this common pattern is very much effective. So let's see here now. So before discussing the common pattern, we'll see warning sign of the paralysis. Person is having sweating in the half body. एक व्यक्ति को आधे शरीर में पसीना निकल रहा है. Maybe half body is having sweating, other half is not having sweating. And sometimes you see sudden stiffness and pain on the cheeks for many days. एकदम से गाल में दर्द होगा और कड़कपन आ गया गालों में, और कई दिनों तक बना रहा गालों में. Warning sign. And pain in the TMJ also. But TMJ pain might be independent also. ये independent भी हो सकता है, right? The warning sign are half body paralysis. The book, Yellow Emperor book, Yellow Emperor. Yellow Emperor was the king of China. He was very expert in acupuncture, so people declared him like a king. And he was having very wonderful knowledge of acupuncture philosophy, even feng shui. So there is a conversation between Yellow Emperor and the physician who was working with Yellow Emperor. There is a book. In that book, there is a conversation. That conversation between Yellow Emperor, who is the king of China, and the court physician, Chipo, उनके बीच में कन्वर्सेशन है. उस कन्वर्सेशन में उन्होंने क्या बताया है? वन डे द मेनी डिसाइपल वाज सिटिंग अराउंड, कई सारे विद्यार्थी बैठे हुए थे. एंड वन पेशेंट केम एंड ही वाज हैविंग हाफ बॉडी स्वेटिंग. उसे आधे शरीर में से पसीना निकल रहा था. येलो एम्परर टोल्ड, just seen this patient and okay, told come tomorrow. He bent. Then Yellow Emperor told tomorrow he will come with paralysis. Understood? Now question goes, why he didn't treat? उन्होंने नहीं treat किया उसको? Because he was having 100% confidence that he will treat tomorrow. But how a student will learn? So the same happened. The person came today, means one day earlier, with a half body sweating, आधे शरीर में पसीना. Next day, same patient came with a paralysis. Then he did the treatment. फिर उन्होंने उसका treatment किया. So this is written in the cheapo. There are many protocols has been given by Dr. Yang. That was also very famous doctor of China, TCM practitioner. So the first thing he told, as soon as the patient comes, the first thing you can do is stimulate, do the stimulation of some point. जैसे ही आपके पास पेशेंट आता है, चाहे पैरालिसिस होने वाली है या हो चुकी है, first what we have to do, quickly we have to balance entire body. Wherever the imbalance is, we have to balance quickly. So how to balance it quickly? So this is the 12-point formula. Quickly, special formula for the paralysis, stimulate all alarm point. We know 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. Stimulate all the 12 alarm point. This is the first formula for paralysis. Whether the paralysis, whether the wind stroke because of the external wind stroke reason, or it is because of the internal wind stroke reason, the first thing we should stimulate the 12 points that is called the alarm point. सबसे पहले हमें इन 12 पॉइंट्स को स्टिमुलेट करना है. क्योंकि अगर विंड स्ट्रोक एक्सटर्नल रीजन से हुआ, external wind stroke is not that much dangerous. Internal wind stroke is more dangerous because there is some deficiency in the body, there is some weakness in the body, there is some problem in the meridian causing the internal wind stroke. It will take some time. And in the internal wind stroke also, I told you two types, organ and meridian. What do you think, which is more dangerous? आपको क्या लगता है कि ऑर्गन की प्रॉब्लम से जो होगा वो ज्यादा डेंजरस होगा या मेरिडियन की प्रॉब्लम से होगा वो ज्यादा डेंजरस होगा? व्हाट डू यू थिंक? राइट. सो ऑर्गन is, suppose someone is having kidney problem, kidney organ problem, and that wind stroke is more dangerous. Someone is having heart organ problem, pancreas organ problem, that wind stroke might be more dangerous. So that's why we have separate formula for the wind stroke because of the organ, and the separate formula wind stroke because of the meridian. Organ is not a small area, but organ, suppose talk about the kidney. Do we have some role of kidney in entire body? क्या किडनी का कोई रोल है हमारे शरीर में? बहुत बड़ा रोल है कि नहीं? Regarding the heart, do we have some role of the heart? Big role of the heart in the body. So the first formula, we have to activate the all alarm point. And there after that we will be discussing many formulas. And at last we will be making one formula कि चलो हमने विंड स्ट्रोक तो ठीक कर दिया, लेकिन the fixing the wind stroke. Fixing wind stroke means कि भाई बार बार ना आए. एक बार हो गया ठीक है, बीपी सूट अप हुआ विंड स्ट्रोक हो गया, दूसरी बार भी बीपी सूट अप हुआ विंड स्ट्रोक हो गया, दो तीन बार विंड स्ट्रोक आता है कि नहीं आता किसी को? Every next time the wind stroke will more dangerous. Every next time it is more dangerous. So let's see first how to stimulate these 12 points. Then we'll also see how to fix the wind stroke. कि हम इसे fix कैसे करें ताकि भविष्य में ना आए. कहते हैं तीसरी बार का विंड स्ट्रोक तो बहुत खतरनाक होता है. पहली बार में तो जान बच जाती है, तीसरी बार में तो जान जाने का खतरा रहता है. So we have seen the 12 points. Quickly we'll see all the location of the 12 points. The point number 1 is the lung 1. हमारा पहला बिंदु है lung 1. So we have to massage this point. This point is below the collarbone. हमारी collarbone से लगभग 1 चुन नीचे है. If we press the hands, we can see the triangular fossa here. In this fossa, we have to massage this fossa, and below the collarbone, we have this point. So generally we have to massage this. हम इसको massage करना है. Don't put the needle here until and unless you know how to put properly. So this is the collarbone. From the collarbone, if we go one tune down, that is the location of lung 1. हम इसे वन tune नीचे जाते हैं तो हमें ये lung 1 मिलता है. From the central line, it is a 6 tune apart. हमारी central line से 6 tune apart होता है. So this is the alarm point of lung. If you tap this point every day, अगर आप इस पॉइंट को टैप करते हैं तो हाइपर एक्टिविटी बढ़ती है. हाइपर एक्टिविटी. So we never tap this point for the hyperactive kids, but it's a very good point for all other person who are not hyperactive, like you, me, all the persons. If we tap this point, it will improve the yang force. It will increase the yang force. It will improve the lung energies, vital field, by tapping this point. If it is a gentle massage, because this is the collarbone. From the central line, if I go 6 tune apart, I can measure 6 tune. Then from collarbone, if I go 1 tune down, there is a location of lung 1. I can do the gentle massage every day and to keep my lungs fit. Sometimes this point will be very, very painful because this is the alarming point of the lung meridian. ये हमारे lung meridian का alarm point है. तो lung meridian में होने वाली कोई भी disharmony इस point को sensitive बना देगी. So anyone is having little bit doubt, oh, might be I am having some percentage sign of the wind stroke. Start massaging this point every day. Just massage this point for 30 seconds. Enough. Definitely it is good point for lungs, for asthma, for all the problem which is connected to the lungs, cough and cold and all. Right? This is the first point. Second point we'll talk about. अब दूसरे point की बात करते हैं. Each and every point is one of the great point here. There are too many points are in the CB meridian. हमारे CB channel में बहुत सारे points हैं. First, let's talk about the point that is CB 70. Yes. CB 70. Point found in between the nipple. हमारे nipple के बीच में पाए जाने वाला एक बहुत ही बेहतरीन point है. So the CB 17 is the very special point for chest cavity. It balances the chest cavity, it balances the lungs, it balances the heart, and it found in between the nipple. It is very good point for asthma. It is very good point for heart. ये हमारे pericardium का alarm point है. If this point is painful, maybe some problem in the heart and pericardium. So this is the point. Generally, we can needle this point, but very, very carefully. Right now, I'm not talking about the needling. I'm talking about the massage. I will tell you, this point is having too much storage of the emotional energy. इस point पर बहुत emotion इकट्ठे होते हैं. CB 17 पे. Suppose some person is having some emotional problem in the childhood, maybe anxiety, maybe some problem, maybe some emotional trauma. It will be stored on the CB 17. Just we massage the CB 17 and just we move the sternum bone. So this is our sternum bone. If we keep the hand here, one hand, this muscle part on the sternum bone, other hand, and just be the little press and just do up and down movement very gently. Do 8 to 10 times, then release it. So slowly we can work on the anxiety, we can work on the emotional things, because emotions are stored in the heart or in the many places. Like in the female, the emotions stored in the heart and in the pelvis or in the uterus. Female को pelvis और uterus में और sternum में emotion इकट्ठे होते हैं. If any female is having some emotional issues, These two parts become very sensitive and painful. If we talk about the male are having storage of the emotion in the sternum bone. CB17, one of the great point, it is called alarm point of the pericardium. Maybe some person is having some emotional trauma, and because of the emotional trauma and having some problem, rising of BP and moving toward the paralysis, wind stroke, we can release from here. हम यहाँ से release कर सकते हैं, right? So it is a CB17 point. We can stimulate this point every day. In the Ayurveda, what we do, we put the cotton in the oil, some Bata Shamak oil, some painkiller oil, and that balm oil we keep on the CB17. It also activates this point. Now, next point, that is the alarm point of heart. हमारा जो अगला बिंदु है वो हमारा हार्ट का अलार्म पॉइंट है. So we can see here CV14. So this is CV14, the alarm point of the heart. How to measure this point? So there are ways. So suppose this is the sternum bone and this is the navel, ये नाभि है. If we do the half, अगर हम इसका half कर दें, right? Means from the lower end of the sternum bone to navel, if we do the half. So this is the fortune and this is the fortune. Right? I will repeat once again. So look at here. This is the navel and this is sternum bone. If we do the half. So this is the fortune and this is the fortune. Then again we do upper half. So two chun here and two chun here. So this is the alarm point of heart. If you feel this complicated, then it's very simple. From the navel go 6 chun up, नाभि से 6 chun ऊपर जाओ. 1, 2, 3, 4, 5, 6. From the navel, if you go 6 chun up, that is the location of alarm point of the heart. Many times this point will be very much painful. Just you, what do you do? आप अपनी छाती में sternum bone को सर्च करिए and see where it's ending. ये कहाँ पर end होती है? Suppose it's ending here. Suppose it's ending here. From there, if I go 2 chun down, where my sternum bone is ending, from there, if I go 2 chun down, that is the alarm point of the heart meridian. ये हमारे हार्ट का alarm point है. आपको क्या लगता है कब दुखेगा, कब दुखता होगा ये पॉइंट? When the person is having any heart problem and any emotional problem, this point also will be painful, very much painful. The person is having any emotional problems, because heart is the place of emotions. We can do gentle massage. Here हम यहाँ पर gentle massage कर सकते हैं. Very gentle massage, because if we do very vigorous massage, this point will be painful for 2 more days. अगर आपने यहाँ पर बहुत तेज मसाज कर दी, ये पॉइंट 2 दिन तक दुखेगा. So this was our the CV14 14 point. Let's see the CV12 point. अब हम CV12 की बात कर रहे हैं. The CV12 point is exactly in between. ये एकदम से बीचों बीच होता है CV12. यानी स्टर्नम बोन और नेवल के ठीक बीचों बीच पाया जाता है, जस्ट इन बिटवीन द sternum bone and the navel, exactly in the center. Exactly in the center. So that is the location of CV12. We can see in this image. This is the point, CV12. So from the navel till the sternum bone, this total length is 8 ch. If we do exactly half, that is CV12, the alarm point of stomach meridian. So even in the acupuncture, we are putting the needle here for treating the stomach. हम stomach को treat करने के लिए यहाँ पर needle लगाते हैं. What is the benefit? When we stimulate the CV12, what do you think? What will happen? क्या होता होगा? सोच के बताइए. क्या होता है? CV12. CV12 is the very special point. CV12 also called the junction point of all yang meridian. सारे yang meridian इसे cross करते हैं. As soon as you activate the CV12, it balance your stomach, not only stomach, but all the yang meridian. Definitely you can do stimulation of all the point in the ब्यूल also. अगर आपके ब्यूल में भी करना है, आप सारे पॉइंट कर सकते हो. You can stimulate all the points in the ब्यूल. So CV12 is the alarm point of stomach meridian. So definitely we'll be working on the stomach meridian. But it will also work for many other things. Mainly 3 things. Number 1, it is very good for stomach meridian. Number 2, it's very good for spleen. अगर हमें spleen को मजबूत करना है तो हम CV12 को एक्टिवेट करते हैं, because all the yang meridian crossing this point, all the 6 yang meridian crossing this point. So as soon as you activate the CV12, it improve all the yang meridian. This is the third benefit. But mainly right now we are stimulating this point because it is the alarm point of the stomach, because we are stimulating all the alarm. हम सारे alarm point को stimulate कर रहे हैं, से भी कर रहे हैं. Let's move to the next point, that is CV4. अब हम CV4 की बात करें. Let's talk about the CV5 first. Actually, why I'm talking CV5 first? There is a reason. So this is the navel. ये नाभि है. From the navel, if I go 2 chin down, that is CV5. Then again 1 chin down, CV4. Then again 1 chin down, CV3. 1 chin, 1 chin. All are 1 chin. CV5 is the alarm point of triple warmer. CV4 is the alarm point of small intestine. CV3 is the alarm point of urinary bladder. So there are 3 alarm points just next to each other. ये तीनों के तीनों alarm point एक दूसरे के पास हैं. So triple warmer, small intestine and UV. These 3 are the wonderful combination. ये तीनों इतने अच्छे combination हैं. Because we know triple warmer can be considered as a super fire. A small intestine we can consider little in middle, and UV channel we can consider in the bottom, By the stimulating these three alarm points, we can stimulate entire body, we can balance entire body, we can balance the triple hormone means brain, we can balance the small intestine means heart, and we can balance the UV means kidney. हम ये 3 पॉइंट लगाकर हम पूरे शरीर को एक्टिवेट कर सकते हैं। ट्रिपल वार्मर आपके ब्रेन को बैलेंस करेगा, ऐसे ही आपके हार्ट को बैलेंस करेगा जो चेस्ट में है, और यूवी किडनी को। सो वी कैन बैलेंस एंटायर बॉडी जस्ट बाय 3 पॉइंट्स। So these are very important alarm point. Triple warmer. So let's see here. First, triple bar. We should stimulate this point. We can massage this point. So this is the alarm point of the triple warmer, which is 2 chun down from the navel. जो नाभि से 2 चुन नीचे है from the navel. If we can keep all the finger like this, all the finger are 1 chun width, 1 chun gap. So there are 2 chun down, that is CV5. We can massage here. CV4 is down, SI, the alarm point of SI. अगर हम इन तीनों पॉइंट को लगा देते हैं तो हम पूरे शरीर को बैलेंस कर सकते हैं, पूरे शरीर के मैकेनिज्म को बैलेंस कर सकते हैं। सो द डिस्टेंस बिटवीन नेवल टू पीविक बोन 5 चुन, हमारे नाभि से पीविक बोन की दूरी 5 चुन की होती है। इफ दिस इज अ नेवल एंड दिस द पीविक बोन, दिस टोटल लेंथ इज 5 चुन। सो वी आर मेकिंग 3 पॉइंट्स, CV5, CV4 and CV3. CV5 will clear the upper body, means brain. CV4 will clear the middle body, chest, and till the diaphragm, and CV3 will clear the lower body. अगर किसी व्यक्ति को अपर बॉडी में कुछ गड़बड़ है, CV5, मिडिल बॉडी CV4, लोअर बॉडी CV3, we can clear it. हम इसे क्लियर कर सकते हैं, right? That's why in the TCM we know it's a very famous formula. Someone is having unwanted some toxin in the lower body, we use CV3. Someone is having unwanted toxin in the upper body, like at the brain level, we use CV5. Regarding the toner, said it depends whether you, अगर आप उस organ को, अगर आपको कोई प्रॉब्लम नहीं है, आप प्रिकॉशनरी कर रहे हैं, सिर्फ ऑर्गन को टॉनिफाई कर रहे हैं, तो मसाज करिए, टॉनिफाई करिए. यू कैन डू द मसाज और टॉनिफिकेशन if you are doing general treatment. If the person has got some attack, then be sedate. तो हम sedate करें. You want to do the cleansing, then be sedate. अगर आपको कोई गंदगी साफ करनी है तो हम sedate करते हैं. You want to do the cleansing, then sedate. Right? So now we are moving to the alarm part of the large intestine, because we have to stimulate all the alarm point. हमें सारे alarm point stimulate करना है. In the sequence now, we are stimulating the alarm point of the large intestine, that is stomach 25. 2 chun away from the navel, हमारे नाभि से 2 chun दूर है, उसका नाम है stomach 25. So this is the navel region. If we go 2 chun horizontal, there is a location of stomach 25. ये हमारे stomach 25 की लोकेशन है, एंड नाभि के लेवल पर है, बट इट्स अ वेरी गुड पॉइंट फॉर large intestine. So we can balance the large intestine. Large intestine play a very much important role. Many old person are getting paralytic attack because of the large intestine severe weakness. They are going in the shock, even in the coma. Large intestine play a very important role. The alarm point of the large intestine we can stimulate in all the condition. हम सारी condition में stimulate कर सकते हैं, जैसे कि constipation होना, piles होना, fistula होना. In any conditions, we can stimulate the point of large intestine. It's a very, very special point. लेट्स मूव टू द नेक्स्ट पॉइंट, वेरी इंपॉर्टेंट 2 पॉइंट फाउंड इन द लिवर मेरिडियन, हमारे लिवर मेरिडियन में पाए जाने वाले दो बहुत ही महत्वपूर्ण पॉइंट। द नंबर 1 इज लिवर 30, वी कैन सी हियर इन दिस इमेज, दिस द टिप ऑफ द 11th रिब, हमारी 11वीं पसली का टिप होता है, द टिप ऑफ 11th रिब, so we can palpate the ribs, and if we go in the border of the rib and you will find the tip of the 11th rib here, that is liver 30, coming near over the level of navel in the anterior axillary line. So this is the liver 30, right? तो लिवर 13 को हमने ढूंढने के पहले आपको कई तरीके बताए थे। एक सिंपल तरीका बताया था, bend your elbow like this, and where the elbow is reaching, there you can feel the tip of the, वहां आप अपनी 11वीं पसली का टिप फील कर सकते हो। You can feel the tip of the 11th rib. Make sure, if we talk about the axilla, so this is the mid axillary line. We can draw the 3 lines: anterior to the axilla, mid of the axilla, posterior to the axilla. So we are not talking about the line posterior, we are not talking about the midline, we are talking the anterior axillary line. In this line, we will find the 11th rib, the tip of the 11th. Where our elbow is reaching, we can find. Or we can go from here, finding the lower rib, and keep on going, and we will automatically reach here. Now we'll find the tip of the 11th. On the tip of the 11th rib, we have very important point. Even the tip of the 12th rib, we have very important point. Both are alarm point. हमारी जो 11वीं और 12वीं पसली के जो टिप पर पाए जाते हैं, दोनों अलार्म पॉइंट होते हैं। अब हम 11वीं पसली की बात कर रहे हैं। You can see in this image, so we are talking about this rib. We can see this is a floating rib, 11th number rib. The tip of the 11th number rib, there is a point. Even the tip of the 11th, 12th number rib, there is a point. Right now, we are talking about the point, the found on the tip of the 11th rib, that is liver 30. That is alarm point of spleen. ये हमारे स्प्लीन का अलार्म पॉइंट, यानी लिवर 13 को आप स्टिमुलेट करते हो, बैलेंस आपकी स्प्लीन होती है। So that's why it's a very very important point, because जितने भी एक्यूपंक्चर डॉक्टर हैं, सबकी स्प्लीन कमजोर है, सबकी। पूछो क्यों? क्योंकि सब अपने दिमाग का प्रयोग करते हैं कि नहीं करते? नहीं करता कोई ऐसा। सब पढ़ते हैं, अपने पेशेंट की चिंता करते हैं। Yes, doing now. So all person having spleen deficiency, spleen weakness, right? At least you can do one thing: sleep on the time, and get up in the time, eat on the time. So, and stimulate the liver 13 point. If you activate the liver 13 point, if you massage the liver 13 point, it will balance your spleen. Let's talk about the another point, that is liver 14, very important point. अब अगले पॉइंट की बात करते हैं, जिसका नाम क्या है? लिवर 40, वेरी वेरी इंपॉर्टेंट। लेट्स सी इन दिस। पहले आप ये देखिए, फिर मैं आपको इजी तरीका बताऊंगा इसको ढूंढने का। लिवर 14, liver 14 is the alarm point of liver, and we know if the liver is having problem, this point will be painful. अगर लिवर में कोई भी प्रॉब्लम है, ये पॉइंट दर्द करेगा। दिस पॉइंट फाउंड इन द निपल लाइन, ये निपल लाइन में पाया जाता है। तो कहां होता है आईवी पैच? एग्जैक्टली वेयर इट फाउंड। सो फर्स्ट यू शुड अंडरस्टैंड कि ये देखिए कहाँ है, पहले तो देखिए निपल कहाँ है, हियर इज द निपल, निपल आर बिलो फोर्थ रिब, निपल चौथी पसली के नीचे, then we can see the fifth rib, then the sixth rib, so this point found below the sixth number rib. There's another point also found in the below the seventh number rib, we'll be discussing shortly. But right now we are talking about the point found below the sixth number rib, जो छठवीं पसली के नीचे होता है. Right, this is a very very good point for liver. That is liver 14. एक तरीका आसान इसे ढूंढने का, वो तरीका क्या है आसान? अगर आपको पसलियां नापना नहीं आती, आपके पसलियां कैसे नापे, कौन सी नंबर की पसली है? Sometimes it becomes difficult. Then how you measure the ribs? Definitely you can measure it, but so how can you do it? From the navel, first you search CV14. नाभि से CV14 search करो, navel, so 3 chun and 3 chun. This is the CV14. This is liver 14 and CV14 are the same level. Liver 14, CV14, liver 14. So CV14 and the liver 14 in the level of nipple. ये दोनों एक ही लेवल, इन दोनों का एक ही लेवल, तो ऐसे पहचान सकते हैं. Liver 14 is very very important point. Nowadays everyone needs stimulation of liver 13 and 14 both, because everyone is having little bit problem of the liver, maybe fatty liver, maybe some anger, frustration, revenge, गुस्सा, irritability, सबको है थोड़ा बहुत. So liver 14 is very very important, but that's why see in our liver chi stagnation protocol we have liver 3, 13, 14, है कि नहीं? तीन दोनों पॉइंट्स है, liver 13, 14 is there or not? That's why liver 14 is very very effective point. हमारे पास जो भी पेशेंट आता है मुझे होमवर्क दे सकते हैं, भाई you activate your liver, these 2 points, liver 13 and 14, at least these 2 points. उन्हें बोलिए कि भाई आप ये 2 पॉइंट स्टिमुलेट करिए एवरीडे. आप चाहें तो उसके साथ उनको एक दो और भी पॉइंट बता सकते. So I will show you once again this point liver 14 in the other image. अब मैं आपको दूसरी इमेज में दिखाऊं. Let's see. So look at here in this image. So below the 6th number rib we have liver 14. In the same way below the 7th number rib we have gallbladder 24. So liver 14 and the gallbladder 24 are exactly in the same line. One is liver 14, one is gallbladder 24. So liver 14 is the alarm point of liver and the gallbladder 24 is the alarm point of the gallbladder. ये दोनों बहुत ही शानदार पॉइंट. So let's see in this image. In the nipple line only, if we are going below the 7th number rib, in the 7th intercostal space, we'll find the gallbladder 24, and this is the alarm point of the gallbladder. ये हमारी gallbladder का alarm point. So we can massage this point. Now the last point, अब हम आखिरी point देख रहे हैं, that is gallbladder 24 देख लिया, 25 भी देख लेते हैं. But 25 is located on the side. Let's see this. Now we are palpating the 12th number rib. अब हम 12वीं पसली नाप रहे हैं. This is the 12th number rib and this is the tip of the 12th number rib. It's a very important point and very effective for the slip disc and the sciatica. That is gallbladder 24, alarm point of kidney. ये हमारी kidney का alarm point. This point found on the tip of the 12th rib. ये हमारी 12th rib के tip पर पाया जाता है. and this is the point gallbladder 25, the alarm point of kidney, कि हमारी किडनी का अलार्म पॉइंट है, हम इसे रोज स्टिमुलेट करते हैं, कैसे, ऐसे. We are keeping the hand like this. In the Marma Shastra, we keep the hand like this. See, push and lift, push and lift, push. So this is the activation of the gallbladder 25, alarm point of the kidney. Very effective point for Sylvitis and the sciatica, and with the help of this point, we can work on the kidney. हम किडनी को ठीक कर सकते हैं. So I will show you one video, quickly see. चलिए एक वीडियो देखिए आप लोग. जब भी हमारे शरीर में कोई प्रॉब्लम होती है तो उससे जो कनेक्टेड अलार्म पॉइंट होता है वहां पर दर्द होता है. लंग 1. So we know this is the collarbone, and if this is the corrugate process, अगर हम corrugate process से medially जाते हैं, so this is the location of lung 2. If we are going one tune down, so this is the location of lung 1. Lung 1 is the alarm point of lung. तो जब भी हम इसको प्रेस करें और यहाँ पर दर्द मिलता है तो ये लंग की कंडीशन बताता है कि सर्दी, खांसी, कफ एंड कोल्ड और कुछ भी लंग्स की फिजिकल और इमोशनल प्रॉब्लम्स हो सकती है. इमोशनल प्रॉब्लम जैसे सैडनेस, डिप्रेशन, फीलिंग ऑफ गिल्टी, ये भी हमारे लंग मेरिडियन से कनेक्टेड है. तो ये हमारा लंग 1 हुआ. इसके बाद नाउ आई एम कमिंग टू हियर, दिस इज द नेवल रीजन. अगर हम नेवल रीजन से 1.5 चुन लेटरली जाते हैं, दिस इज 2 चुन, दिस इज 1.5 चुन on the left side and 1.5 chun on the right side. This is the location of stomach 25 and this is the alarm point of colon. तो जब भी हम इसको प्रेस करते हैं और इसमें दर्द मिलता है तो we are pressing here, oh tenderness. इसका अर्थ है कि लार्ज इंटेस्टाइन में कुछ प्रॉब्लम है या कोलोन में कुछ प्रॉब्लम है. तो हो सकता है कॉन्स्टिपेशन हो सकता है पाइल्स, फिस्टुला, हेमरोइड की प्रॉब्लम हो, डायरिया हो, लूज मोशन हो, यानी कुछ ना कुछ लार्ज इंटेस्टाइन की प्रॉब्लम पाई जा सकती है. So this is the alarm point of large intestine. So this is the navel and this is the lower end of the sternum wall. Navel से लेके lower end of the sternum तक की ये टोटल लंबाई होती है, ये 8 चुन की होती है, 8 चुन. इसमें ठीक मध्य में यानी 4 चुन की दूरी पर ये हमारा रेंट वेल्व पाया जाता है. रेंट वेल्व हमारा अलार्म पॉइंट है स्टमक का. अगर हम इसको प्रेस करें और यहाँ पर अगर दर्द मिलता है तो ये बताता है कि स्टमक में कुछ प्रॉब्लम है. हो सकता है गैस एसिडिटी हो, इंडाइजेशन हो या स्टमक अल्सर हो. So there may be any condition related to the stomach. So this is the range valve and connected with the stomach. Now, if we are coming from the nipple line, we are going down, 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 down. So this is the lowermost 12th rib. So 12th rib, if we are going little up, so we are going between the 12th rib and 11th rib at the junction. अगर हमें पेन मिलता है, so this is the position of liver 13. अगर हम सीधे खड़े हो जाते हैं और अपनी कोहनी को फ्लेक्स करके रखते हैं तो हमारी कोहनी का ऑलिकरण प्रोसेस जहां पर 11th फ्लोटिंग रिब के फ्री एंड को टच करता है, इसे हम लिवर 13 पॉइंट कहते हैं. यह स्प्लीन का अलार्म पॉइंट है. अगर स्प्लीन की कोई भी प्रॉब्लम होगी तो यहाँ पर टेंडरनेस और दर्द मिलेगा. तो स्प्लीन का काम है डाइजेशन, इंडाइजेशन को कंट्रोल करना, हमारे बॉडी के अंदर हीमोग्लोबिन को, विटामिन B12 को, ब्लड के सारे कॉन्स्टिट्यूशन को मेंटेन करके रखना. अगर किसी को वीकनेस है, कमजोरी है, टायर्डनेस है, इंडाइजेशन है, स्प्लीन की कोई भी प्रॉब्लम है तो हमें स्प्लीन के फ्रंट 2 पॉइंट्स पर दर्द मिलेगा, दैट इज लिवर 13. सो नाउ इफ वी कम अप, हमें पता है कि निपल जो होता है वो हमारे 4th इंटरकॉस्टल स्पेस में होता है. 2 रिब्स के बीच का जो स्पेस होता है उसे हम कहते हैं इंटरकॉस्टल स्पेस. तो निपल 4th में होता है. अगर हम इससे थोड़ा सा नीचे जाएं, करीब 2 चुन, नियर अबाउट 2 चुन डाउन, सो वी विल फाइंड लिवर 14 पॉइंट. द लिवर 14 पॉइंट लगभग हमारे 6 इंटरकॉस्टल स्पेस में पाया जाता है. सो दिस इज द लोकेशन ऑफ लिवर 14. And if we praise this point, and if it is tender, so it is showing the problem in the liver. So liver 14 जो निपल से लगभग निपल इज इन द 4th स्पेस एंड लिवर 14 इन द 6th स्पेस। तो अगर इसको हम प्रेस करते हैं और यहाँ पर दर्द मिलेगा तो समझ आइए देयर मे बी सम कंडीशन कनेक्टेड विद द लिवर। अगर इसी से हम थोड़ा सा और नीचे जाते हैं, सो दिस इज अगेन नेक्स्ट 5th स्पेस नियर अबाउट 1 सेंटीमीटर डाउन, and this is the location of our next point, gallbladder 24, and gallbladder 24 is the alarm point of gallbladder। तो देखिए हमें एक ही लाइन में लिवर का अलार्म पॉइंट मिला on the 6th intercostal space, then on the 7th intercostal space हमें मिला gallbladder का point of spleen। so जो दूरी होती है वो 5 चुन की होती है, 5 चुन। अगर हम पहले हम एकदम 5 चुन नीचे चले जाते हैं, दैट इज रैंक 2। अब रैंक 2 को छोड़ के हम एक चुन ऊपर आए तो रैंक 3 मिलेगा। तो रैंक 3 हमारा जो होता है वो पीवी से एक चुन ऊपर है, या फिर यहाँ से 4 चुन नीचे है नाभि से। तो अगर किसी को रैंक 3 पर पेन मिलता है तो रैंक 3 इंडिकेट द कंडीशन ऑफ यूरिनरी ब्लैडर। इफ देयर इज एनी पेन, एनी प्रॉब्लम रिलेटेड टू द यूरिनरी ब्लैडर, so there will be alarming on the urinary रैंक 3। अब हम इससे थोड़ा ऊपर आ जाते हैं, रैंक 4। रैंक 4 इज अलार्म पॉइंट ऑफ स्मॉल इंटेस्टाइन। तो ये पूरा हमारा एक प्रैक्टिकल वीडियो है, यू विल सी दैट। सर आई पुट इन द ग्रुप, आप देख लीजिएगा इसको। तो दिस इज द वीडियो एंड I will show you this is the video, and in that correct information about the only stomach 25 point, which is the alarm point of the large intestine, and go through with that video. I will put in the group. Only do the little correction which I told you and see this chart. So today we have discussed, I know this is a very basic thing, but we can't underestimate the basic thing. So I discussed with you. ये बहुत ही बेसिक चीज है और I know that everyone knows this, but we have to discuss each and every basic thing and other thing also. So tomorrow we will be discussing few other formulas. Closing now.